Next question, we go to Shanghai Media Group. That's Bin Chen, if I'm pronouncing correctly. Can you hear us, please?
Yes, thank you.
Yes.
This is Bin Chen from Europe correspondent from Shanghai Media Group. Greetings from Berlin. So yesterday, the Austrian health minister said that Great Britain's rate of new coronavirus infections frightens a lot of people in Europe if we compare the new cases of the UK to the other 7 European countries. So is WHO aware of the sharp rise in the UK, and what can we learn, like other European countries can learn from that? Thank you.
Didn't hear your question very well, but I think in general you were talking about the differences in numbers in different countries in Europe, and I think all countries have gone through and are in different stages of their epidemics. It is not useful to compare countries at different stages of their epidemics. I think we see countries have passed a peak or arriving at a peak, and some countries are considering lifting of restrictions and some others not. And I think all of those decisions have been taken carefully. We've advised very clearly that countries need to make those decisions with great prudence. They need to walk back and move back and transition from measures associated with large societal measures, lockdowns, shutdowns, that needs to be done. But it needs to have in place 3 very important things. One, a completely empowered, educated community, capable individuals who are aware of the physical distancing, the personal hygiene measures that are needed to avoid infection. Communities aware and involved in the process and fully empowered to act and participate. A strong and acceleration and strengthening of the public health capacities for finding cases, for testing, for isolation, and for quarantining of contacts. And this is exceptionally important. And our colleague Tom Frieden in the US has likened this to, we need to start boxing the virus in, not boxing people in. And I think it's a good analogy. We need to start finding the virus, because right now, with the current situation, everybody is locked down in order to stop the virus spreading. The only way we get to shift away from that is finding the virus and then limiting the measures as best we can to those individuals who may have the potential to spread it or may have the potential to develop the disease. And the last part of that is having a strong enough health system, that the health system has recovered enough and has enough capacity built in that it can react. And you're seeing many countries are starting to bring online measured transition. Nobody is removing themselves from a lockdown type situation in a dramatic way. You'll see countries are phasing the response, and they're trying to look at the measurements they're going to use. And what we do appreciate is that countries are leaving time. They're taking some measures, and they're going to wait and see, and then see if those measures can be then further extended, further loosened, further adjusted. And we believe this is a prudent approach. And I think you'll see all countries in Europe eventually doing that. But as I said, each country is in a different stage of its epidemic. And at this point, I think it's really important that we don't start to compare countries as to where they are in the lifting of these public health and social measures. We have to look at the situation they're in and how they're dealing with their unique situation.